Ethical dilemmas, situations, and decisions. Course learning outcomes included in this lecture. Apply ethical principles and decision-making in the daily operation of healthcare organizations. Module learning outcomes aligned with this lecture. Identify ethical dilemmas encountered in healthcare settings. Engage in ethical decision-making standards employing the standards and provisions of codes of ethics. Decisions are incorporated into every part of everyone's day. For nurses, these decisions include ethical dilemmas and difficult decision-making with important interactions between ethical behaviors and legal issues. Nurses need to understand the relationships, overlap, and the distinct differences between ethics and the law. Major areas of ethical risk include the beginning and end of life, death and dying, cultural and religious beliefs, patient competency, genetics and genomics, abuse of others, or considerations related to the futility of healthcare treatments. Considering the distinction between law and ethics, nurses often find themselves pondering if the legal rights of the patients have been fully protected while remaining sensitive to individuals' ethical rights. They may find themselves in the midst of ethical dilemmas among physicians, patients, family members, and their peers. Ethical theories. Ethical theories that pertain to clinical practice settings are generally divided into two overarching theories: deontological and teleological theories. Deontological theories derive norms and rules from the duties that human beings owe one another by commitments that are made or roles that are assumed. Teleological theories derive norms or rules for conduct from the consequences of actions. Ethical principles. Nurses also apply a variety of ethical principles in everyday clinical practice. The main ones are: autonomy addresses personal freedom and self-determination. Beneficence supports actions that promote good. Non-maleficence is the concept that one should do no harm. Veracity concerns truth-telling. Fidelity concerns keeping one's promises. Paternalism is used to assist individuals in decision-making. Justice is the concept that all people should be treated equitably. And respect for others, which incorporates all other principles and transcends cultural differences, gender issues, religious differences, and racial concerns. Moral distress. Moral stress most often occurs when a nurse is faced with situations in which two ethical principles compete, such as when the nurse is balancing the patient's autonomy issues with attempting to do what the nurse knows is in the patient's best interest. Nurses use ethical decision-making models each time there is an ethical situation or dilemma, and the moral model is perhaps the easiest model to use. Like the nursing process, the moral model has 5 steps. Massage the dilemma, outline the options, resolve the dilemma, act by applying the chosen option, and look back and evaluate. Legal guidance. The legal system provides a general foundation for guidance that helps healthcare providers to separate their personal views and value systems from the law and ethical standards. Values are personal beliefs about the truths and worth of thoughts, objects, or behavior. The Patient Self-Determination Act and standards that focus on a patient's participation in healthcare decisions, the creation of advanced directives, and the enactment of do not resuscitate orders and policies address the rights of each patient. The provider's policies and procedures describe how individual rights are protected and exercised, methods for resolving conflicts in decision-making, and a description of the respective roles of physicians, nurses, and family members. Ethics committees. Healthcare institutions have ethics committees that play a central role in the protection of patients' rights, the organization, and its staff. Institutional ethics committees provide structure and guidelines for potential issues, serve as an open forum for discussion, and function as true patient advocates by placing the patient at the core of the committee discussions. Structures used by ethics committees. Models for institutional ethics committees include the autonomy, patient benefit, and social justice models. The autonomy model facilitates decision-making for the competent patient whereas the patient benefit model uses substitute judgment and facilitates decision-making for the incompetent patient, and the social justice model addresses broad social issues. Codes and standards. Also of impact are ethical codes, standards, and guidelines of various organizations such as American Nurses Association, or ANA, American Association of Critical Care Nurses, or AACN, American College of Healthcare Executives, ACHE, and the Joint Commission on the Accreditation of Healthcare Organizations, JCAHO. Professional Code of Ethics and International Code of Ethics. The professional codes of ethics enumerate standards of integrity, professionalism, and ethical norms for members of a given discipline. The International Code of Ethics, available in 12 different languages, has served as a worldwide standard and guide for action based on social values and needs since 1953. American Nurses Association. On the national level, the American Nurses Association, or ANA, publishes a code of ethics for nurses that provides direction for those entering the nursing profession about their ethical accountability, sets a nursing standard for ethical practice, and informs the consumer about nursing's ethical standards. They are utilized as a guide by state nursing organizations. Advocacy. Advocacy is both an ethical and a legal responsibility for nurses. Nurses are in the unique position to be advocates for patients, as they may have the greatest knowledge of the patient's ability to have capacity to be able to make independent decisions. Advocacy consists of three models: rights protection, autonomy model, values-based decision model, and respect or persons model. The responsibility of nurses in advocacy extends to the policy arena to address healthcare issues and dilemmas. When making ethical decisions, consideration of the code's mandates, along with an understanding of ethical theories and principles, values, and decision-making models are essential.